Okay, good morning, everyone, and welcome to our first tute in hand for 2022. This tutorial will be focused on some of the important questions related to skull meninges and TMJ. So let's start with them. I've put some questions here. Some of these are based from the pre-prac activities that we used to adopt from previous years, and others are based from the main points that students find it a bit unclear or challenging related to this. Also, the tutorial will be a great opportunity for you to ask questions. So if you wanted to, if you've got some questions that you'd like to explore further or discuss further, which was not clear either during the lecture or during video clips, please make sure to email your questions to me by Tuesday before the Wednesday tutorial, so I can add them into the PowerPoint, and we can go through these questions there. If you don't want to mention your names, include your names in the discussion, that's totally fine. All right, so coming here into this question, on the following three diagrams of skull shade or using different colors, the following bones of the skulls. So here we've got in the slide notes that you've downloaded on LMS for the tutorial. You should be able to see 1, 2, 3, 4 all the way to the end. So if we look into this one as an example, so the slide notes should be available on LMS in week 1 content. If you go back into week 1 content, scroll down all the way, there will be tutorial 1, and you can find the PDF of the slide notes. And we will do the same each week. So if we're doing tutorial 2 and we've got slide notes for you to look on, it should be allocated for you in week 2. Okay. And by the way, if your name is displaying, can you please just, if your student's ID, can you please right-click on it and change it with your preferred name so that it's easy for me to communicate with you during the class. So thank you. Okay, so if we look into this diagram, this is an anterior view of the skull. Number 2 refers to which bone here? Frontal. Thank you, Margaret. I assume that someone was talking, but I couldn't hear. But Margaret posted frontal bone here. Fantastic. If this is the frontal, how about number 1 here? These are 2 small separate bones.
Nasal bone.
Nasal, fantastic. How about number 8?
Maxillary.
Maxillary, and you can see that here we've got 2 maxillary bones. But how about 9?
Mandible.
Mandible, thank you. Thanks, Zakaria. Also, I saw your answer here, mandible. If you look into mandible, it's only single bone, while for maxillary, we've got 2 separate bones. Okay, how about number 7 here?
Zygomatic bone.
Zygomatic bone. How about number 3?
Temporal bone.
Temporal, beautiful. So number 2 is a frontal. Just behind frontal, we've got the temporal bones. We've got a different view. We'll look into that shortly. But before we go, let's go into that. I'll show you the answer shortly, so just be patient with me. So here we've got frontal. So if we put that one, so if this is a frontal, this one is temporal. Number 4 is what?
I had a question.
Isn't temporal? Yeah, I've got it. Thank you. I'll just redo that. Thank you, guys. So this is parietal, number 3, and number 5 should be temporal. Occipital, thank you, Sunal. So this is occipital will be on number 4. How about number 6?
Sphenoid.
Sorry, can you repeat it?
Sphenoid.
Sphenoid. Yes, thank you. Sphenoid with S, beautiful. And 7, we said it's zygomatic. And 9, it's the mandibular bone. What else? If we look into the inferior view here, number 6, see the sphenoid, how big is? It's like a spaceship. There is there will be yeah, I'll show you in the next. I'll clear that drawing and move that one. So if we look into the following slide, here so that you have a better idea about the sphenoid. See the sphenoid, how big it is? It's like a spaceship with multiple structure, multiple process. So mandible or mandibular bone, that should be fine, Zach. So if you can say it's the mandible or the mandibular bone, that's fine, just like adjective for that, and totally fine. Okay, so to help us all be consistent in the answer, here is the answer sheet. For the ethmoid, it wasn't visible here, but once we go into the following slide, you should be able to see it. So actually, we can identify part of the ethmoid here. If I use annotate again, the ethmoid should be this one. A part of the ethmoid is forming the perpendicular plate here of the nasal cavity. This one and this one as well. So this is part of the ethmoid. And this is part of the, we said previously that the ethmoid is the one that part of the viscerocranium and the neurocranium. So this part of the ethmoid is forming part of the viscerocranium. And if you look into the other views, I'll clear the drawing right now. We'll move to the next one. The ethmoid should be that bit here. Okay, I've got this one. I can't. It should be deeper. We need to look superior. We need to remove the calvaria and look from there. Let's see if I can find it in the other area. Probably that bit. That one. This one. See, this is the ethmoid part, which is the yellowish color part. This is refers to as the cribriform plate of the ethmoid. Cribriform means like sieve-like, so which has many holes. And through these holes, we've got some branches of one of the cranial nerves that pass from the cranium all the way down. Hence, this part of the ethmoid is considered to be as part of the neurocranium. Okay, if we move back into this diagram, so I assume that you all should have all this under control. Okay, so I'll move into this following set of questions in 3.
I'm sorry, I have a question.
Yes.
So where is the palatine bone?
Palatine bone. Okay, beautiful. Let's see. So the palatine, I think it's not that easy to be identified from here. Let's see into the color one. Okay. Palate. So this one. Let's use annotate. Okay. So we've already identified these as the maxillary or maxilla, one of the maxilla, just behind the maxilla, forming the roof of the oral cavity. This is refers to as the palatine bone. Okay, and still we've got right and left. You actually can feel it if you move your tongue towards feel the roof of your oral cavity. Anteriorly in this area, it should be considered as part of the maxilla. But if you roll your tongue towards the posterior aspects of the roof of the oral cavity, you should hit the palate or palatine bone. We call it hard palate in lay English. Okay.
One more question, sorry.
Sure.
The zygomatic arch, where exactly is that formed? I just didn't exactly get where it was.
Nice question as well.
Thank you.
So let's go here. So let's use the coloring stuff. We already said number 7 is zygomatic bone. We all agreed on this. And for number 5, this bone is called what? The temporal bone. Okay. The junction, this arch in between. So if we hide, I use different color, it's better. Let's use the purple one. So if I highlight this one, see the junction between the zygomatic and the temporal bone? This is referred as the zygomatic arch, which is actually consisting of the temporal process of the zygomatic bone, which is this part here, adjoining the zygomatic process of the temporal bone. I'll just
Right. And does that form, that's what forms sort of the boundaries of the infratemporal fossa, or?
yeah, so good rationalization, beautiful. So
Okay.
here at this level, in this level, there is a fossa here, which is called the temporal fossa, okay? And beneath it, it's called the infratemporal fossa. And this will be much better to look on using the three-dimensional orientation. So if you look into the following slide, we go into the following slide. See, this is the inferior view. The zygomatic arch is this one here. See, this one. So above this level, and this is space. So above this space, it's called the temporal fossa. Beneath it, it considers to be as the infratemporal fossa. Realistically, it's a continuous cavity, but anatomically, we have two, we split this cavity into two cavities, temporal versus subtemporal. So it's easier for us to provide description because each one have specific structural paths are unique to these. That's why we split them into two subcavities or cavities.
Okay, thank you.
No problem. You're welcome. So if we go back here, so yeah, we finished that one. If there is no further question, before that, we've got some tubercles or process we can identify. Can anyone tell me what is this one? This process here, I'll use red color, it's much easier. This
Styloid.
styloid process, fantastic. So this should be styloid process. How about this one? Surrounding this foramen.
Foramen magnum.
Yes, so the foramen, beautiful, it's called foramen magnum. But what are these two processes?
Is it the occipital condyle?
Fantastic, occipital condyle. So these two are considered as occipital condyle. Condyles, because we've got right and left. Sweet.
Sorry about that.
This one. Sorry, is that a question?
Yeah. Can I ask about the function of the occipital condyle?
Yes, you can certainly ask. Can anyone help us finding the answer for why we've got the occipital condyles?
It's from the Atlanto.
Sorry, I can't hear you well. If you can post the answer in the chat, or if you can repeat the answer.
Does it articulate with the Atlanto? I can't remember the name.
Beautiful. So we've got the answers here as well. Thank you. So it's articulate with C1 as the Atlanto-occipital, forming the Atlanto-occipital junction. Thank you, Zach, Hannah, Sonal, and the person who are talking. So I can't see your names on the screen right now. So these are important. These condyles are important to enable us to nod our head anterior or posterior to say yes or no. Any other question before we move to the next one? If this is a styloid, how about this one here?
Is that the mastoid?
Mastoid, beautiful. And we'll talk more about this during the workshop. As you can see here, that this is just to prepare us to the practical workshops and also catching up on some of the stuff from the workshop. So here in this slide, it's exactly what we have discussed, but just in colored and labeled, just to help you better understand if there is something which wasn't clear. Hence, you can confirm the answer here. And this have been taken from Clinically Oriented Anatomy by Moore. This is the figure link. However, if you are using different textbooks, should be there. You should find a similar image. There is also a question about the visible body. I think Zach have contacted me earlier today or yesterday, and I can see the discussion here. So if you have visible body application installed on your device from last year, you need to reactivate it. You can either open it here in the university using Wi-Fi, university Wi-Fi, or download VPN, university VPN, and open it from open it remotely. I'll be posting sending instruction on how to reactivate this shortly later today after the tutorial. Okay, so here we've removed the calvaria, which is the upper part of the skull, and we are looking into the skull foramen or foramen of the skull. Obviously, we've got heaps of openings, but we will focus on the main ones that have been available for us here. So in exam, it's most probably you will be expecting to identify structure or one of these openings here, either in a plane foramen or in this one, in schematic diagram, okay? So to help us identify them, let's start the plane one, looking into the plane one. So what we call this one here, as compares to this one here, feel free to use annotate and put your answers directly. How about this one here? Obviously, you can identify this one, this one, this one. What else? Let's see. We can see this one here. Yeah, a little bit. Okay, and this one as well. So these are, we've got much more obviously, but for simplicity, we can identify this one as well. So olfactory foramina, optic canal, thank you. We've got foramina ovale, thank you. Thanks, Dunya. And Mati saying jugular foramen, yes. Hypoglossal canal, it's very good attempt. Hypoglossal is this one here. So this will be hypoglossal. So I would put hypoglossal here. Hypoglossal canal should be somewhere here. It's blunt because sometimes it's closed by thin membrane. What else? We've got optic canal, correct. How about this one here? Foramen. What?
Ovale.
So there is ovale and rotundum. Which one is which?
Is the rotundum one.
So the top one is rotundum. Thank you. And this the ovale and spinosum. Thank you. I can see the spinosum already here. And how about this fissure? What is called? Just beneath the optic canal.
Superior auditory fissure.
Beautiful. Superior orbital fissure. Alrighty, so this is the first point, and by knowing the main foramina here, you will score one of the, because this is one of the classical questions that we use in the exam. Identify this foramina. It said this. The next question might be identify which structure it passes through it and which space it connects and so on. So very relevant questions.
I have a question. Sorry about that. So there's the olfactory foramina and a cribriform plate of ethmoid bone. How to differentiate both, or it's
okay? Very, very specific question. Thank you. Can I? Sorry, I forget your name. What's your name?
Saurabh.
Saurabh. Yes, Saurabh. Thank you, Saurabh. So Saurabh asking, what's the difference between cribriform plate of ethmoid bone and olfactory foramina? So if you look into the two names, this is called the cribriform plate of ethmoid bone versus olfactory foramina. Cribriform plate, it's a plate. So if I ask you about the bony part, it's a plate. But if I ask you about the holes or openings, then it will be olfactory foramina. because the first one is a plate which has several holes. So the cribriform plate has several holes. These holes or openings are called olfactory foramina. So pay attention to the question, identify this bony landmark or identify or name these openings. There is a difference in the answer.
So for the olfactory foramina, there's lots of foramina which are like olfactory one, a lot.
Yes, so it's a plural, yeah, foramina, yeah, fantastic. Any other question before we move to the next one? So I'll remove the drawing in 3, 2, 1. And we'll move to the next slide. The next slide, we have these foramina that we have identified. Rafael asking, Rafaela, sorry if I mispronounce your name, asking about what does SOF stand for? Can anyone help us with the answer?
Superior orbital fissure.
Thank you, Sarab. Thank you. So SOF, this is the SOF, superior orbital fissure. All right, so here we've got these foramina. What we need is to identify the main structure that passes through them in terms of neurovascular structures. Sometimes there might be more than one structure pass, but these, let's go through the main components. So you can also use your annotate and try to fill in the gaps here, starting from the olfactory foramina all the way to the foramina magna structures. Feel free to use annotate and answer any of these gaps that you know, and then we can go through group discussion. Anyone would like to give a go? Okay, so optic canal, cranial nerve 2, olfactory foramina, cranial nerve 1 should be, because olfactory nerve. Okay, I'll remove mine so we can keep one at least. So olfactory foramina, cranial nerve 1, optic canal, cranial nerve 2, superior orbital fissure, cranial nerve 3, 4, V1. Thank you, Shuriti. And 6, beautiful. Foramina rotundum, V, and foramina ovale, V as well. But which branch? V2 and V3. Fantastic. Foramina spinosum, labyrinthine artery. It should be very close to labyrinthine. It's a very close branch to it, but it's not the labyrinthine itself. It's an artery that goes to the dura. So it's called what? A question about textbook. Do you mainly recommend, because there are many textbooks links in HANA. So the main 2 textbooks have been included in the introductory lecture. These are clinically oriented anatomy by Moore and the clinical neuroanatomy by Snell. So clinically oriented anatomy by Moore, we use it frequently for head and neck anatomy. But when we go into the neuroanatomy, we'll use contents from clinical neuroanatomy. However, the content should be available in any anatomy textbook. If you've got other anatomy textbook, feel free to use it. We don't have a new discovery in anatomy every year, so it shouldn't be a huge problem if you use different textbook. Beautiful. So now let's go through them one by one. Olfactory foramina, cranial nerve 1. What we call cranial nerve 1? Olfactory nerve. Okay. Why this color? I don't like. I want this one. Yes, olfactory nerve. Or we use blue color so it's easier also. So in exam, I may ask you about olfactory nerve instead of cranial nerve 1. So it's important that you know the name of the nerve and its number, which make it easier for you to answer any question about it in exam. And the second one is optic nerve. Okay. And what else? So we've got cranial nerve 3, 4, V1, and V1 and 6. So cranial nerve 3 is what?
Trigeminal.
Close, but trigeminal is slightly lower.
Is it the oculomotor?
Oculomotor, excellent. Oculomotor and cranial nerve 4. I'll bring that one down. Cranial nerve 4 is what? Trochlear, excellent. And cranial nerve 5 or V1. So cranial nerve V1 is called ophthalmic. I'll help you with that one. So cranial nerve 5 is trigeminal, but V1, which is the first branch of it, is called ophthalmic. And what else? We said cranial nerve 6, cranial nerve V1, which is 6. So it should be Q6. Thank you, Shruti. So all these are the names of the cranial nerves. Foramen rotundum is cranial nerve V2. What we call V2?
Is it the maxillary?
Maxillary, yep. And V3 should be the mandibular.
Mandibular branch of trigeminal.
Fantastic. Mandibular branch. So the best answer that I'm looking for is ophthalmic, maxillary, or mandibular branch of trigeminal nerve. If you've got a short answer question, if you put ophthalmic, if it is V1 as an example, you put ophthalmic, you'll get 0.5. Branch of trigeminal nerve, you'll get another 0.5. And this is one of the key stuff that we help students to get a full mark rather than missing 0.5s here and there. Okay, foramen spinosum has been left here. Anyone knows what passes through foramen spinosum? It's an artery.
Is there middle meningeal artery?
Middle meningeal artery, yes. Middle meningeal artery. So it's a branch from another artery that we'll cover it on the following weeks. So middle meningeal artery is a branch that goes all the way to supply parts of the meninges from its name. Carotid canal, it's another artery there. I'll just add to the carotid, I'll put internal carotid artery. So you've got the full picture here. Yes, if you have been enrolled in the blended mode and you've got Friday's workshop, we are looking forward to see you all there. We've already started with the wet laboratory sessions for the other anatomy subjects, and PAM3HAN classes will be on Friday. So if you are doing blended, yes, please make sure to come and meet us this Friday. Internal auditory mediators, we've got cranial nerve 7 and 8. So what we call 7?
Hypoglossal nerve.
Hypoglossal is slightly lower. 7 supply most of the face. Yes, beautiful. That's why it's called facial. Okay. And cranial nerve 8 is supplying the hearing and balance. So it's called what? Vestibular. Fantastic. Cochlear nerve. Excellent, Shruti. Thank you. Vestibular cochlear. Now we'll come with the jugular foramen that permit the passage of the internal jugular vein, and also 3 cranial nerves. Cranial nerve, yes, 10, 9, and 11, or 9, 10, and 11. So what we call 10, cranial nerve 10.
Vagus.
Vagus, beautiful. Vagus, and 9. cranial nerve 9.
Glossopharyngeal.
Excellent. Glossopharyngeal. And cranial nerve 11 is accessory. Okay. And then hypoglossal will be the last one. Okay. Now, foramina magna, it's midbrain. I would change midbrain to the lower parts of the midbrain here. So if I use the eraser, try to delete this. I'm not sure if it's working. Yeah, it's working from my end. I can fix this one. So which part of the brainstem? It should be the lower parts of the brainstem. What we call the lower parts of the brainstem. Medulla, beautiful. From medulla. So the medulla oblongata. Actually, it's as it's changing into the brainstem, into the spinal cord. Vestibular. Is it vestibular or vertebral? I'm sorry, I can't read this well. Which one you were talking about for this one?
Vertebral.
Vertebral arteries, yes. Vertebral anterior and posterior spinal vertebral arteries. And cranial nerve, this will be also accessory arteries. Okay, so hopefully this helps you to get heaps of the answers related. There will be certainly frequent questions related to this diagram. It's simple, but it's very important that you know the answers here. And if you go into a textbook, look into much more details, you may find much more details passing at each of these foramina. But for hand purpose, these are the main structure that we expect from you to know.
Sorry, before we move on, are you able to show me the carotid canal on the previous diagram?
Yes, I'll need to remove this in 3. Do you have any question about this before we move to answer this question?
You have a question?
Yes, please. Sorry, is someone else going to ask?
No, you go.
All right, thanks. Can you please explain the or explain again, yeah, the superior orbital fissure and what cranial nerves pass through it?
So the superior orbital fissure.
Yeah, sorry, because I'm seeing it says cranial nerve V1 and cranial nerve V1, the ones that are written in blue, it says ophthalmic and abducens, but they both have the same like sign V1. I thought it's ophthalmic is cranial nerves V or cranial nerves 4, and then abducens has like another like sign to it.
Okay, gotcha, no problem. So for a superior orbital fissure, it permits passes of 3 main cranial nerves and 1 branch of a 4th cranial nerve. So cranial nerve 3, which has 1, 2, 3, this is the how we use it. So CN and put 3 eyes for the number cranial nerve 3, which is called oculomotor. Cranial nerve 4, CNIV, which is trochlear nerve. Cranial nerve 6, CNVI, which is abducens. And also it permits the passage of the first branch of cranial nerve V, which is trigeminal nerve. We call it V number 1, which is the Arabic numeral. So if you look into number 1, it's different from the numeral or the Roman numerals that we use for the main cranial nerves. Hence, you can see it's V number 1. So the V1 refers to ophthalmic branch of trigeminal nerve.
That's true. Sorry, I didn't see because it's written like it's too small, so I thought it just says I or the Roman.
No problem. No problem. That's why we've got these tubes. And we've got V2 and V3 for maxillary and mandibular branches of trigeminal nerve, respectively.
Okay, that's perfect. Thank you so much.
No drama, mate. Other question about this before we move back into to talk about the carotid canal? Okay, so we'll move into the next slide in 3, 2, 1.
Someone in the chat said that the textbook said just medulla for the foramen magnum.
So medulla or medulla oblongata, that's fine. For me, I prefer to be very systematic. I specify the structure as medulla oblongata, but in exam, if we put medulla only, we will accept it for her. Just if you've got a different textbook, they may put the full name. That's why I put the full name here, but medulla should be fine.
Thank you.
All righty, so we've cleared that one and we'll move to the slide above. Your question about internal carotid canal?
Yeah, sorry, just on the next image that popped out, the one where I had to label ourselves.
Okay, so I'll just see if we can, because it's best to be seen from the internal aspect. It should be jugular form. So no, not in this area. It probably somewhere here in this area. It's not shown. It should be somewhere here in this area. So can you see the jugular foramen? The carotid canal should be on the other side on this. It's not shown here. Well, it will be much better if we look on it in 3-dimensional rather than this one here. So if we look into the location here, see, this is the split between the middle and posterior cranial fossa. So the carotid canal should be within the middle cranial fossa compartment, while the jugular foramen will be on the posterior cranial fossa compartment. So if you look here, the jugular foramen is this one. The carotid canal should be here somewhere. It's a canal. So it's not foraminal lacerum, which is this one. It's carotid canal. It's a canal. It's the opening here, but it's not very clear because we need to look much more anteriorly. The view is a little bit obscuring the canal itself, but it's actually this one here. This one. This area.
Thank you.
No drama. Okay, let's move to the next one. So the next topic here is about about the main cranial fossae, or the 3 cranial fossae, the anterior, middle, and posterior cranial fossae, which are these, the one that we have identified here. If you look into the colored one, these are the boundaries between the anterior, middle, and posterior. So if we use this one, the plain ones, as an example, and we use a different color. So this should be, this is the landmark between the anterior and middle, and that would be the landmark between the middle and posterior. So all this region refers to the anterior cranial fossa, and everything here should be related to the middle cranial fossa, and inferiorly, all this region should be related to posterior cranial fossa. So the table in that slide will tell us or ask us to provide more details about the boundaries of each cranial fossa and openings available inside and which structure they pass. As an example, if we look into the anterior cranial fossa, if I ask you about the boundary, so anteriorly, which bone you would expect to find in the anterior surface? Can you repeat the answer, please?
The frontal bone.
Frontal bone, fantastic. How about in the posterior side? What we call this?
Greater wing of sphenoid.
The lesser wing.
Lesser wing of sphenoid, fantastic. Because we've got the greater wing of sphenoid here, and the lesser wing of sphenoid is the boundary, its boundary. So in that, we need to develop the answer while we look into this. Beautiful. And how about the floor of it?
Maxilla?
Maxilla, possible, yeah. Frontal as well. See, the frontal is coming here. What we said, this one is
Ethmoid?
ethmoid. So you've got ethmoid, you've got frontal anteriorly, okay? Part of the maxilla, maxilla is, I think it's much lower here, but the sphenoid, lesser wing of sphenoid forming the floor and posterior wall, lesser wing of sphenoid as well. Maxillary, I think it would be much lower than this. I would stick with the frontal ethmoid and lesser wing of sphenoid. I'll need to confirm with the maxillary. I'm not 100% sure, so I'm a bit reluctant to confirm it here in this. But 3 bones should be fantastic. If you more than enough. And then if we ask about the openings available, you can say it's the olfactory foramina, and then name an important cranial nerve that passes through it. You can say cranial nerve 1. Does this make sense? Thank you, Sarah. So this is how we need to answer this sort of question. That's why I put the table to work on it. If we look into the posterior cranial fossa, because the middle will slightly challenging. If we look into the posterior cranial fossa, so posteriorly, which one we've got? If we look into the boundaries, posteriorly, we've got what?
Occipital bone.
Occipital bone, beautiful. So you've got occipital bone posteriorly. I'll use right color. So we've got occipital bones forming the posterior wall. How about the anterior wall of it?
The petrous part of the temporal bone.
Wow, well on the spot, beautiful. So it's called petrous part of temporal bone. Lesser wing of sphenoid, petrous part of temporal bone. I'm just putting the abbreviations right now. How about the floor of it? Part of occipit and part of the temporal bone. Okay, so occipit plus temporal bone. Okay, now if we ask you about the openings that you can identify here, so you can say foramina magnum. What we said this opening is?
Jugular.
Jugular foramen, beautiful. And how about the little one here? Permit passage of cranial nerve 12, hypoglossal, yes. There's a question about, so what does OTT and PPT stand again? OTT, so sorry, this is occipital bone plus temporal bone. PPT, petrous part of temporal bone. Okay. LWS, lesser wing of sphenoid. We will practice a lot of these terminologies during the workshop. So don't stress if you don't know the answers or if you don't know the full names at this stage, because we'll play more with the names during the Friday workshop. So if we need to talk about, and what else? There is another foramina here, which is this one here.
Sorry, what was the other one? What was this one?
So we've got foramina magnum, we've got jugular foramen, and this is hypoglossal canal.
Oh, hypoglossal. Thank you.
And you're welcome. And this foramina here, just under PPT word, this which permit passage of cranial nerve 7 and 8, connected to the
Cranial acoustic meatus.
Fantastic. Internal acoustic meatus or internal auditory meatus. The one that we've just discussed in the diagram and went through these openings. Okay. And then you should be able to identify or easily say like internal acoustic meatus, permit passage of cranial nerve 7 and 8 as we previously discussed. Jugular foramen, permit passage of internal jugular vein, plus a cranial nerve 9, 10, and 11. So we've just covered this in the previous slides. Here we're just putting all the information into the table. That's why I'm verbally discussing them. Now it's much easier for us to go through into the middle cranial fossa. So boundaries anteriorly, it will be LWS, which is lesser wing of sphenoid. Posteriorly, PPT, which is petrous part of temporal bone. Okay. Laterally, we would expect the temporal bone.
Isn't it the parietal bone or?
Yes, thank you. I was just about to say it. So temporal bone and parietal bone superiorly as well. Okay. And if we talk about the openings, you can say optic canal, superior orbital fissure, foramina ovale, sorry, rotundum, ovale, spinosum, lacerum, which we haven't covered in hand, and internal carotid canal as well. And then the next question might be which structure passed, just refer to the previous discussion. Does this make sense to you guys?
What did you say the posterior boundary was of the middle cranial fossa?
Okay, so the posterior boundary of the middle cranial fossa is PPT. So PPT, which is the petrous part of temporal bone, forming posterior boundary of middle cranial fossa, and at the same time forming the anterior boundary of posterior cranial fossa. It's the same border, but located in the posterior surface of NCF and anterior surface of PCF.
Thank you.
You're welcome. I'll just clear the drawing and move back into the table. So you can take a snapshot in 3, 2, 1. So why I went verbally through this, so that you know what to put here. You don't need to put a lot of details, just like some boundaries should be fine. Openings, as we discussed in this one. So just look here and list the main openings that you can identify in each. And contents, the answers that we put for each opening. You can insert the contents. So in addition to put part of the brain. So like, for example, the frontal lobe sits mainly in the frontal lobe of the brain, sits mainly in the anterior cranial fossa. The temporal lobe mainly sits here, while posteriorly, we should be able to identify the cerebellum, pons, and the medulla, which is part of the brain stem. Okay, in addition to the structure that pass through the foramina. So this is one. Can I ask you as homework to aim answering this question and post your answer on discussion forum for week 1 so that everyone can help complete the answer here. We quickly went through it, but just because of the sake of time, we don't have sufficient time to go through all the answers here. When we catch up on Friday, if there is really something that you are not sure of, please feel free to ask us, myself or the other demonstrators if you have been allocated in the other workshops. So far, so good? Yes, someone say yes.
Yes.
Thank you. So what we've got next. Next, this slide has been covered in the interactive lecture about the meninges. So if you haven't watched the lecture from Monday, please go back and look into these, just a way of an idea to briefly highlight the 3 layers of the meninges. Why I've put that slide here, just to show you this one, which is the falx cerebri. This is the one that we said it's coming downwards, split the cerebrum into right and left cerebral hemisphere. And if you are doing online workshop, you can't see the wet specimen. That's why we are using this wet image. This is the falx cerebri. By the way, this view is lateral and superior, slightly towards the posterior aspect. This is the ear, okay? This is the left side. We have open part of the skull. This is the falx cerebri. The cerebellum is sitting here. The next slide is we'll remove the cerebellum. We are removing the brain itself, keeping the cerebellum, and we can see the tentorium cerebelli, the other septum that split the. This one is, I'll just show you. This is this one, the tentorium cerebelli, which split the cerebellum from the cerebrum. And these can be seen here. We've got right and left tentorium cerebelli. Question here, What is the relationship of the falx cerebri to the anterior and middle cranial fossa? So the falx cerebri should sit midline. So what's its relation to the anterior and middle cranial fossa?
Would it create the medial wall?
Yes, so it's located medial to or forming the midline or split the anterior and middle cranial fossa into right and left sides. Beautiful. Or some answers would say that located medial to the anterior and middle cranial fossa if we consider that we've got right and left anterior cranial fossa, so that the falx cerebri will be medial to them. However, your answer it should be correct. What is the relationship of the tentorium cerebelli to the posterior cranial fossa? So posterior cranial fossa should be here. Tentorium cerebelli is here. So its relationship doing what? Forming what?
So the roof.
Fantastic. It's forming the roof of the middle cranial fossa. Sorry. Don't worry about this. We will discuss this much more details later on, but this is just to highlight the dura mater, the thick one, the arachnoid mater, and the pia mater. Why I've put here, just to show you the subarachnoid space, and we've got the blood vessels here. No problem. If you've got a class, please feel free to leave and jump to the next class. I'll quickly go through that and upload the recording at some stage today. So the idea here at this stage, I would expect you to know the three main meninges and the location of the cerebral arteries within the subarachnoid space, which is this one here. We'll talk more details about the dural venous sinuses during the practical workshop. And this is a coronal section. Because the next slide, it's a lateral view showing the main dural venous sinuses. So we've got, I'll use the annotate and we'll put that one. So this, if you look into that one, this should be considered as the superior sagittal sinus. This one should be the inferior sagittal sinus. And this one is the, oh, fantastic. Thank you. Straight sinus. Thank you for putting the answer here. And the junction here is considered to be as the confluence of sciences. And in looking into the lateral aspects here, you can see this one, which is called the transverse sinus, which goes all the way into the sigmoid sinus. And then blood eventually drains out through the jugular foramen. Jugular foramen, which exit, so it should be internal. Let's see if I can redo that. So it will be the internal jugular vein. Internal jugular vein, which should exit the skull through the jugular foramen. Okay. This should answer all this. There is a video clip about this available to you in week 1. Have a go through that. And if you wanted to take a snapshot, I'll move to the next 3, 2, 1. This is the temporomandibular joints have been covered in the interactive lecture. I just put it here as an preparation for you, just to look into this simple diagram to show you how TMJ works together, I mean the right and left works together to perform different movements. During the practical workshop, we'll try to practice this movement and see which muscle work in which situation. So please use this diagram as a reference for you for a practical workshop. Then we've got the muscles of mastication that we've covered in the interactive lecture. So if you watch the interactive lecture, you should be able to identify these muscles. I just put some details about them: origin, insertion, their action, which might be helpful for us to know, and their innervation. And why I've put this? Because we've got a few slides about these muscles. We'll use them as well during the discussion on Friday for the online workshop. So temporalis muscle is here. The masseter muscle can be seen here. If we open the masseter muscle, we can see the medial and lateral. This is the lateral pterygoid and medial pterygoid. So in the practical workshop, we will explain their origin and insertion and then rationalize the mechanism of action for each one. I've just added here because these are some of the bit challenging muscles for students to identify. This is the medial pterygoid, and this is the lateral pterygoid muscle. And we'll also be able to look into the plastinated specimens, whether online or face-to-face workshop. We'll need to look into some of the relevant plastinated specimens. Any question before I stop?
Do we need to bring a lab coat on Friday or not?
Yes.
Okay,
Yes,
perfect,
please.
thank
So
you.
on Friday, you need to bring your lab coat. Mask will be also required from you to put while inside the lab, although it is not required from outside on campus, but inside the lab, due to the not being able to maintain physical distancing. Besides, we've got issue with the air conditioning, so it's currently a lot of work is currently being done. So we'd really appreciate that you maintain the safety OH and S, including having a lab coat, fully covered shoes, and having mask on during the class. What I was trying to say as well, we will have a common introduction during for the first few minutes, and then we'll go into the class. If you start in the dry lab, then the next hour you'll be moving into the wet lab. If you start in the wet lab, then the next hour you'll be moving into the dry lab. So check your practical group available on Start Here section to confirm which area you will be starting in. If it is online, feel free to log into the Zoom link next to your designated workshop to meet with our demonstrators there. Thanks all. I'll see you or catch up with you on Friday. Bye.